ADHD stands for Attention Deficit Hyperactivity Disorder. It is a neurobehavioral problem involving lack of attention, hyperactivity, impulsivity, or a combination of these symptoms. It is also referred to as ADD or childhood hyperkinesis. ADHD is a brain disorder marked by ongoing patterns of inattention and/or hyperactivity, impulsivity that interferes with daily function and development. It can profoundly affect academic achievement, well-being, and social interactions of children. Children with ADHD can be diagnosed by having either key behavior, inattention, or hyperactivity impulsivity. It is most common for children with ADHD to have a combination of both key behaviors. There are many symptoms to be classified as the inattentive type. These symptoms are: the child does not pay attention to detail, he or she makes careless mistakes, they fail to pay attention, they are unable to follow or understand instruction, they avoid tasks or frequently lose material to complete the task, they are easily distracted and forgetful. Symptoms of hyperactive impulsive type include fidgeting, squirming, gets up often when seated, running or climbing in inappropriate times, has trouble playing quietly, they talk too much and are interruptive. The child's pediatrician should initiate an evaluation for ADHD for any child 4 through 18 years of age who presents with academic or behavioral problems and symptoms of inattention, hyperactivity, or impulsivity. In order to make a diagnosis, the primary clinician must be sure that the criteria in the Diagnostic and Statistical Manual of Mental Disorders, the DSM, has been met. Reports such as documentation and referrals from parents, teachers, and other mental health professionals is where the primary clinician would gather his or her information from. This fact stresses and exemplifies the importance of a general classroom teacher's influence on a student with ADHD and other mental health illnesses. There are more than 3 million cases of ADHD per year. ADHD is more common in males than females. The Center of Disease Control says approximately 11% of children are diagnosed with ADHD between the ages of 4 and 17. Children are more likely to be diagnosed with ADHD if their mother consumed alcohol or had a substance abuse issue while pregnant. ADHD is also associated with there being a certain level of lead in a child's food consumption. ADHD is one of the most common referrals for mental health and pediatric services in the United States. Children with ADHD, as they get older, are more susceptible to addictions such as nicotine use, drugs, and alcohol abuse. ADHD is associated with depression and anxiety. It is also associated with disruptive behavioral disorders such as oppositional defiant disorder and conduct disorder. Both general classroom teachers and special education teachers do not feel they have adequate training to deal with students that have ADHD. This can be very problematic because ADHD is one of the most common referrals for mental health and pediatric services. Regardless of inadequate training, behavior intervention plans are the first treatment attempt for children and adolescents diagnosed with ADHD. Therefore, teachers must use proper teaching techniques to help their students with ADHD improve in all aspects before they are prescribed medication. There are many teaching strategies and approaches that can help a student with ADHD get the most out of their education. Accommodations is just one of many intervention strategies that help students with ADHD complete tasks. A couple recommended accommodation for students in the classroom with ADHD are to change their seating location in the classroom throughout the day and to alter the length of their assignment into smaller, more manageable tasks. Antecedent-based approaches or interventions is a collection of practices in which environmental modifications are used to change conditions in the learning environment. It focuses on events that immediately precede problematic academic or behavioral performance. Changing learning context in the classroom is one example of an antecedent-based approach. Consequence-based approaches are designed to provide students with either reinforcement after appropriate behavior is exhibited or punishment if inappropriate behavior is exhibited. Daily report cards and other forms of behavioral contracts are effective consequence-based approaches. Growing evidence supports that explicit strategy instruction that incorporates self-regulation instruction can enhance academic skills for students with ADHD. There are many evidence-based practices and strategies teachers can implement in the classroom to have a positive effect on a student with ADHD in their classroom.